Welcome to Raise the Line with Osmosis from Elsevier, seeking solutions with leading experts on how to increase healthcare capacity so people can get the care they need during the pandemic and beyond.
Hi, I'm Shiv Gaglani, and today I'm really happy to welcome one of the scientists responsible for the renaissance in psychedelic research that we've been exploring recently on the Raise Line podcast. Here are just a few of Dr. Matthew Johnson's contributions to the field. He's one of the world's most published scientists on the human effects of psychedelics. He helped establish psychedelic safety guidelines. He published the first research on psychedelic treatment of tobacco addiction in 2014. He received the first grant from the U.S. government in over half a century to directly study therapeutics of a classic psychedelic, and he is a co-founder and president of the International Society for Research on Psychedelics. Dr. Johnson is also a professor in psychedelics and consciousness and psychiatry and behavioral sciences at Johns Hopkins University, and has conducted widely cited research in behavioral economics, behavioral pharmacology, and behavior analysis. Areas of focus include the decision-making underlying addiction and the effects of drugs on sexual risk behavior. You may already be familiar with him because Dr. Johnson has established himself as a go-to resource for journalists at major outlets such as the New York Times, Washington Post, and 60 Minutes, and you may have also seen him on Big Think, the Andrew Huberman podcast, and the Lex Friedman podcast. So Matt, thanks for taking the time to be with us today.
Thanks, Shiv. Pleasure to be with you. One thing I'll update is I'm a former president of the International Society for Research on Psychedelics.
Oh, you already were doing so much. So I'm glad to hear there's one less thing completely on your plate, so it frees you up to do more, even other things. So we always like to start with just getting your background, like what got you interested in psychiatry and behavioral pharmacology, and then ultimately psychedelics.
Well, I'm a psychologist, so what got me interested in psychology is really, wanting to understand what drives human behavior. I mean, to me, these are interesting questions. The ability to apply a natural scientific understanding to understanding behavior. I was really attracted to the work of, when I was in college, of B.F. Skinner. I was a former engineering major, and kind of took a leap out of that because I didn't really see that path as being one that led me in a direction that I really wanted to go into. So the idea that one could understand behavior from a truly scientific perspective, and then the idea that one could bring those tools to bear on helping people and addressing the many problems that are behaviorally mediated, which is essentially all of the problems individually and planetarily. I was really attracted. And then, sort of the interest in psychedelics were a subset of my broader interest in psychoactive substances that interface with that interest in behavioral science. The idea that these compounds, anything from caffeine to alcohol to the illicit, substances, including psychedelics, could have such a profound effect on behavior, on the mind, if you will. And so, those were sort of the seeds that led to my interests.
Yeah, no, and I'm glad you talk a bit more about how behavior does result in pretty much all the problems and all the solutions ultimately. I went to med school at Hopkins initially to be a surgeon, but changed my course because I met a stage 4 cancer patient who had been smoking for decades, many pack years of smoking, and the financial and emotional cost to him and his family to treat this cancer that may have been prevented had we had been able to intervene behaviorally through education, counseling, etc., maybe psychedelics, got me really more interested in primary care, psychiatry, and ultimately now psychedelics too. So that was first how I heard about your work, is the landmark smoking cessation work. Can you take us back to the origins of your work on that? And for our audience that may not be familiar with it, some of the highlights of the work around smoking cessation.
Yeah, I have been very interested for a long time. I mean, dating back to my undergraduate years, about the history of research with psychedelics. So there was a sort of initial heyday from the late 50s to the early 70s before the rug was pulled out, for a lot of reasons, the association with the counterculture, and some very real casualties from reckless use by a lot of people. That said, there are a lot of people with credible claims of it having profoundly benefited their life, but it's complex, as as most things that are, powerful are. And, consistent with my interest in psychoactive drugs and their effect on the mind and behavior, I was very interested in that older research on alcoholism being treated by LSD. There was a little bit of research treating opioid addiction with LSD. And then there's all these anecdotes of people quitting all sorts of different substances. And I had a history going back to very early grad school and conducting research on nicotine and tobacco from various, and I've done all kinds of work in the years since with nicotine, tobacco, basic behavioral economic analyses, looking at the role of nicotine and tobacco reinforcement, really what motivates and drives continued behavior, treatment questions, the interactions with other substances, even substances like cocaine and caffeine. So nicotine and tobacco were in my wheelhouse as a scientist. And the emerging picture that I was seeing with psychedelics and addiction was a very different one from other forms of addiction treatment, certainly very different than anti-addiction medication, in the sense that it seemed like we were dealing with a generalized anti-addiction potential efficacy with psychedelics that transcended the particular substance of abuse that was the source of the addiction. And so with most addiction medication, the effects are typically relatively specific to that particular substance. So in other words, you're treating tobacco use with nicotine replacement therapy, either patch, gum, lozenge, et cetera, even, e-cigarettes really broadly defined, as essentially substitutes, ways to quell the reinforcement, withdrawal, craving effects by stimulating or interacting with that primary receptor mediating the effects of the substance of concern, but in a different, in a way that's less harmful to the person. So exact same story with any other, so-called agonist or substitute treatment. So including methadone and buprenorphine for opioid addiction. So it really looked from the scattering of older research and really rounding that out, just the complement of stories that were just anecdote at that point, that when people recovered, it sounded more like good psychotherapy, or in some sense 12-step, in the sense that this is not about just sort of quelling the response to that drug of abuse, addressing it that way. You can put it in many different ways, but it's about the narrative of your life. It's about the role that's fit, what's meaningful to you, these big picture decisions about, what is life about, people finding themselves going down the primrose path they never would have, wanted a priori to be, spending so much of their time, their money, taking the health risks, et cetera, dedicated to using this, whatever the particular, substances. So big picture insights in successful treatment with these methods, therapy, 12-step, things like, and I should say, most people that recover from virtually any substance don't get any formal treatment of any of these types. But so, and more consistent with those stories too, where someone just comes to a point in their life and they, in one way or another, say, I'm done. This does not fit with me anymore. And it's usually there's a narrative there. It's something about, this big picture stuff. And, it's not that you can describe it through humanistic psychology terms, spiritual terms, if you will, about this kind of the big picture of your life and what is meaningful in life, what is life about. But it's also, just the way I would put it as a behavioral psychologist, it's about your behavioral economy, the degree to which one reinforcer in life has hijacked things such that other aspects of your life you recognize are suffering. There's a narrowing of this behavioral, which in my view includes the mental, but this narrowing of the behavioral and mental repertoire in a suboptimal way. And so the picture to me was that these stories of people overcoming addiction with psychedelics sound more like that stuff, successful psychotherapy or successful 12-step or just successful, coming of age, getting to that point in your life and deciding enough is enough and taking some, big picture changes in your life. And so I thought, why not? Why not smoking? There were a little bit of questions I had about, some of the narratives with addiction recovery, particularly when we're talking about very intoxicating substances like alcohol and opioids that typically have more life disruption than something like, tobacco addiction. Very, rarely does someone like ruin their marriage, their kids are estranged from them, they've ruined their job or their career because of tobacco, cigarette addiction. But, not necessarily typical, but it's certainly more common with these other more intoxicating substances. So there was some question like, is psychedelic recovery dependent on a rock bottom effect? In fact, the very early researchers in Saskatchewan, Canada, doing work with LSD and alcoholism, that was their model that, when do a lot of people get better with alcoholism? It's when they get the DTs and they nearly die, and then they sober up because they're scared to death because they've hit rock bottom. The problem is that something like a quarter, I believe at the time, of folks that had some full-scale DTs like ended up dying. So, is there a way we can instigate this type of dramatic, scary, scared straight effect without killing someone? It's like, here's this, newfangled drug LSD that in the prevailing model at the time temporarily makes people feel like they're psychotic, but it's freakishly safe at the physiological level. There's some risks for some particularly vulnerable populations, and we can talk about that later if you want. But for most people that aren't suffering from, so let's say, severe heart disease, there's no known lethal overdose. So now people can die from being intoxicated and wandering into traffic, et cetera. But at the just pure, it doesn't kill your liver, doesn't make you stop breathing, doesn't give you a stroke, heart attack. The way that if you lethally overdose on most substances, it's one of those types of ways. It doesn't come anywhere, it doesn't have those effects. So it's like, can we model those DTs? And so there's a little bit of question, like, since people don't have rock bottom effects on tobacco, will this really work? So there's some curiosity there. But I scoured websites like Blue Light and Arrowwood for stories, and lo and behold, even though no one had really ever made a thing out of this, there's these little trip reports out there here and there sprinkled amongst millions of reports that said, I took a big dose of acid or mushrooms, and folks will say, I just quit smoking, and this was like a month ago or a year ago or 5 years ago or more. And then I got interested, I started asking stories of people, and I remember meeting someone actually at Burning Man in 2005 that said, he quit smoking, it was something like 40 years ago, on a big therapeutic LSD trip for something else. He wasn't taking it therapeutically to quit smoking. So all of that together, just I thought, hey, let's test this. It was interesting. If it worked, it kind of would add to this, complementing the older science. It would be consistent with this idea that there's this very general anti-addiction efficacy, which would be exciting. It would be somewhat of a test of whether it only worked with sort of drugs that typically come with a rock bottom effect, as I described. And then, it's a great model system of addiction because it's a regulated, commercial product. Everyone knows how many cigarettes you smoke a day, whether they buy a pack once every day or once every 2 days or 3 days or once a week. There's multiple, and this is a big advantage compared to alcohol, which I was considering getting into. But there's a big advantage that there are multiple ways to pretty cheaply biologically verify with a pretty accurate time course. With alcohol, if you want that type of anywhere close to accuracy, you have to get people to wear essentially a scram bracelet, like basically a prison bracelet, around your ankle or something, or hair analyses, which can tell you something about whether someone's used the substance over the last several months, but there's essentially no temporal resolution around it. So there's a lot of like really, methodological scientific advantages as a model system of addiction to look at tobacco. But then you step back and also it's like, it's a good model system of addiction, but it's kind of a problem in itself. I mean, just to take one metric, the number of deaths, it absolutely wipes the floor with everything else. In the US, we're talking about almost 500,000 people a year that die from smoking, with the vast majority with about 69% of adults in the US who smoke wanting to quit. And that number of 500,000 a year just is like, it's orders of magnitude beyond most other substances. It's 4 times the number of people that die from alcohol. And then all of the illicits, if you plot these things on the same figure on a linear scale, all of the illicit substances put together are barely visible
Wow.
on the same graph when you compare it to, alcohol and then tobacco deaths.
Wow.
So, besides being a good model system of addiction, it's kind of important in itself.
Right.
So it's like if we could, bring this to bear to help a small percentage of those people, I mean, it would be huge. So
Absolutely. That's super compelling. I appreciate your thought processes, which is useful for our audience because many of them are early stage researchers and healthcare professionals. And as they decide what paths to follow, what diseases to focus on, et cetera, kind of hearing your thought process is helpful for them. And many of them probably are interested in this problem of smoking cessation. To add to the death toll you were mentioning, I pulled up the CDC data, which as of 2018, which is the latest I could see, cigarette smoking cost the U.S. over $600 billion. So $240 billion in healthcare spending, $185 billion in lost productivity from smoking-related illnesses, so COPD, asthma, etc., lung cancer, and then $180 billion in lost productivity from smoking-related premature death. So it's a tremendous, if this could be effective for that, which again, you're one pioneering a lot of that research. So what did you find? Like, what have you found as far as how efficacious the psilocybin trials were, or other psychedelic maybe trials relative to patch or other interventions for smoking cessation?
So the pilot study, which we published, had 15 people. It was a non-randomized, small pilot study, and we wanted to test the waters. Wasn't even worth my, unless I saw a good signal with a small sample like that. One, I couldn't hustle up more money for, so that pragmatically limited things, but it also, I wouldn't have wanted to spend the time with a very large randomized trial unless I even thought there was a potential signal there. You might try it in 10, 15 people and it's a complete flop. And so, test the waters, but it looked really promising. So all of that said, the results of that type of study could only show whether it's worthy of continued research. You can't prove anything about the drug itself, but we got 80% of people at 6 months after their quit date were biologically confirmed with both urine cotinine and breath carbon monoxide, 2 of those biological metrics I mentioned, and self-report, abstinent, and that held up with a very long-term follow-up of 2.5 years, which is well beyond what most studies probe. Our initial results were so interesting, we actually applied to the Institutional Review Board to invite people back to do another biologically confirmed assessment. And on average, it was 2.5 years after their quit date, and that was 60% of people. So those are just, insanely high numbers for the field. Again, with the caveat that, this isn't a randomized study comparing to these other things, but, typical results, like the best medication that's ever been looked at in the field is varenicline, which people may know by the brand name Chantix, with something the studies vary from the mid-20s to mid-30s, maybe upwards close to 40% at 6 months. So somewhere from the 20s, 30s% typically at 6 months compared to 80% in terms of point prevalence abstinence. So if that question is this worthy of follow-up? The answer was absolutely. And so we recently conducted the final session for the 6-month data on the second trial, which is a randomized trial. It was a comparative efficacy trial, randomizing over 80 treatment-resistant smokers to either nicotine patch treatment or the psilocybin intervention. And so in this case, just one psilocybin session. The initial study was 3 psilocybin sessions, but there were some reasons why we scaled it down to 1. But so these aren't official results yet. The most recent analysis that I have to report today is based on a peek I took at 61 patients. It's not a blinded study, so I can still speak to the results without taking a statistical hit. But I really have to emphasize it's, the only results that count are the ones at the end, but the last stab at 61 people with about 30 in each group, the results were, depending on how you count it, in the 50% at 1 year follow up. For example, 52% in the psilocybin group compared to 27% in the nicotine patch group at 1 year, which is actually certainly on the upper side of what you get when you look at the results across the literature for nicotine replacement, including nicotine patch 1 year out. 27% is very good, and so that was very encouraging, and so stay tuned because we'll be submitting our results of that trial relatively soon with the final results, which will be, looks like, a sample of 82 people. And a little bit earlier, when we had those data, we used those data to apply for a government grant, a National Institute on Drug Abuse grant. Long story, but eventually got it. We have that funding. We've had some logistical problems in starting the study, getting a hold of the study medication, and some legal issues. But we're close to starting, that trial. That's going to be a blinded trial, and it's cross-site with University of Alabama, Birmingham, and New York University as other sites in the study. Yeah, so that's where we're at now. The study we're finishing up is a comparative efficacy study. As I mentioned, there wasn't blinding. I really wanted that as the next step because as someone who's been in the field for years, and I've personally been in dozens of psychedelic sessions, you really are modeling something weird with double-blind studies with psychedelics. I'm not saying it shouldn't be done. There's no such thing as the perfect experiment. There's always pluses and minuses to any particular design. The real overall results come from, a human being looking at those different studies and sort of triangulating across those results. But you just see these weird things, like you warn the person in a psychedelic study, oh, this may be one of the most terrifying experiences of your life, and all these wild things that they're just to some degree impossible to fully describe to them, may happen, and you may think you're dying, but we'll hold your hand through it. I mean, it's a clinical vulnerability that really rivals perhaps anything else in medicine. I mean, certainly going under surgery, there's complete trust. It's like, yeah, I'm trusting these people to cut me open, but at least I'm unconscious during that time. It's not like, oh, I mean, I've had multiple vets. They've experienced combat that have said this has replaced that as being the most intense experience of their life. I mean, it's hard to overstate, how serious people describe this experience. So when you set that scenario up, and then, in a placebo-controlled trial, you might be guessing, an hour and I haven't felt anything, hour and a half, you're modeling something that is very bizarre, as you could imagine. Like, people are really, really worked up and then nothing happens. You're modeling something that's never going to happen, basically, and straight up clinical. And I could tell you it's really, really weird. Again, I'm not saying we shouldn't do placebo-controlled trials, I think, but it needs to be complemented. But that comparative efficacy study, that's the way you treat a new psychotherapy where blinding isn't possible. And we have tons of evidence, and we know a lot about mental health treatment through psychotherapies. I mean, some of our most effective treatments in mental health are, I would say, psychotherapy, such as the treatment of anxiety disorders, phobias, this type of thing, through systematic desensitization and prolonged exposure therapy. Very effective. None of that's been done under blinded conditions because it's not possible. So you take someone who's has the disorder, they're willing to do one of the multiple treatments, the two different treatments, you randomize them, and you follow the results. And yes, some or all of it could have been driven by placebo effect, but hopefully then in other studies you can determine whether it's all driven by placebo effect. I mean, we do know with psychedelics that the subjective experience, we're pretty confident that's not just placebo effect. Some really dramatic things happen biologically, that account for the very altered state of awareness during psychedelics. What we don't know, for example, is how much expectancy is driving those ultimate therapeutic results, but decreases in depression or addictive behavior. So that's where we're at now with the smoking cessation work. And so we'll have to wait for the final results of that current randomized comparative efficacy study, and then those results from the newer, soon to start double-blind multi-site trial.
That's fascinating. I'm really excited to read those papers when they come out, and thanks for the preview. I like your analogy to surgery because actually just last week at the Psychedelic Science conference in Denver, which I'll ask you about in a second, I met the co-founder of Journey
Mm-hmm.
Collab, which is working with
Mescaline.
rehab
Yeah.
centers to and various rehab centers, and it's his name is Jishan Chowdhury, and
Yeah.
actually we've covered a lot of AI on this podcast, and his executive board member Sam Altman, the CEO of OpenAI. So just
Ah.
very
Mm-hmm.
interesting intersection between AI and psychedelics. We can talk about in a bit too, but he talks about rather than psychedelic assisted therapy, maybe calling it psychedelic surgery or something like that
Mm-hmm.
that speaks to how serious this can be and often is, and also put healthcare providers and patients in the mindset of there's a pre-op, there's the operative, and there's post-op, and a lot of the pre-op is informed consent. Post-op, there's often an acute hospital stay. Not necessarily you don't necessarily need that in psychedelic therapy, it seems, but maybe with some populations you do. But having real follow-up, like the integration period that people talk about with psychedelic assisted therapy. So I like your surgery analogy there too.
Mm-hmm.
Let's talk about PS 2020. You can respond to that, but also talk about PS 2023. I assume you were there.
Yeah.
What were your takeaways from it? And if you prognosticate with the next year, couple of years, what are you most excited about or worried about when it comes to psychedelic assisted therapy?
It was a really fascinating meeting. There's, a lot of good friends and colleagues that have been in this field. So it's good to catch up with folks. What a demonstration that the field has expanded, and it's coming with all kinds of things as one expands, especially when you're talking about a powerful tool. Like, things are getting complicated. There's going to be good and bad. And one of the critiques, actually read a recent really good article, in part drawing from the meeting by Jules Evans, really critiquing this kind of new religion component of the psychedelic science area. And I've been really concerned about that, because I see even within the deepest layers of science, it's very difficult to trust people with magnitude of effect in people. And I still have my hopes and my bets on the idea that there's going to be more good than bad, but it's going to get really ugly. I mean, there's going to be cults. There already are. I mean, there's this bizarre, even hero worship of scientists, and some of them are, let's just say, some of them embrace that role and really kind of like want to play the guru, as if they have the mystical secrets to everything, and I can tell you, people can get really unbalanced, and there's going to be a lot of harm. I think there's going to be more benefit, but I think we saw threads of that at the meeting, and some concern about that, the kind of the new religion kind of aspect of this, that people pretty routinely have these experiences that what they will say. I mean, it's hard to understate the magnitude with which many people describe these experiences. That's just a very difficult thing to hold in a responsible way. And at the same time, as this field is it's really exploding in popularity, I tell you what, anyone who thinks that people who have used psychedelics or have an interest in psychedelics and have learned about psychedelics are somehow more moral and ethical people, I've been in this field for about 20 years. There's a lot of hatred. There's a lot of all the ugly stuff. Everyone is like grabbing for their piece of this. There's people protesting, things where you're not even clear about what's being protested about. You just get the sense that there's these deeply seated grievances, more about the state of the world. There's people with very strong anti-capitalist feelings, and that when the companies started coming in, it's like psychedelic medicine, has become a target. With all of this, I take a balanced perspective. Yes, when the profit motive comes in, it opens up on average a relatively increased concern about those particular perverse contingencies, and that's to be taken account of. But every communist revolution I've been aware of has been an abysmal failure, to say the least, with the death toll in the dozens, if not hundreds of millions. So we, every medical intervention that any family member that I've gone through has been in the dirty old for-profit system, that somehow has still helped a lot of people. And yes, we got to be aware of those perverse contingencies. But I can also say I've been around nonprofits, including universities, for my entire career, and the perverse contingencies, you know, they they may just take a different flavor on average, but there are perverse contingencies everywhere. And so I think people can be blindsided. I often think of the psychedelic bard, if you will, I guess, Terrence McKenna, sort of the Tim Leary of the 90s, who really emphasized this, that said, look, psychedelics don't make you better people. And that's a real big problem because people think they become better people. I think he said something like that he had just gone through a pretty nasty divorce. He said, ask my ex-wife how ethical and how wonderful of a person I am. Humans are humans, and that's a real issue with this area. So it went into a lot there, but I do have some very big concerns about where things are headed. Again, I'm still betting it's going to be more good than bad, but compared to 5-10 years ago, I'm more pessimistic. I'm more concerned about how ugly this is going to get.
Wow. Yeah. Thanks for sharing all that. And I agree with a lot of your sentiments based on, as a fairly new person to the space, as an outsider who's talked to a lot of researchers and CEOs of different psychedelic assisted therapy companies. I agree. Like, I was actually kind of surprised that, for medicines that are described as leading to ego dissolution, dying before you die, essentially. I'm a huge fan of Stoicism. There's actually quite a bit of ego. Just we're humans, right? And people like to be tribal and follow a leader. We had a guy on the podcast named Scott Carney, who's based out in Denver. He's a friend now. He's written several great books as a medical anthropologist, including The Wedge, where he describes, an MDMA couples therapy session he did with his wife, as well as his New York Times bestseller was What Doesn't Kill Us, which helped popularize the Wim Hof method. And Wim Hof, who's a cold ice man, they call him.
Mm-hmm.
And he actually introduced me to Wim. I met with Wim.
Oh, great.
Went to his expedition in January in Poland. And I was amazed. He oftentimes, it's the guru. Like, he's like, hey, anyone can do this. It doesn't require me to do it. And he said this multiple times. But the natural inclination of the people who attend was to basically deify him, right? Just one guy had a tattoo of him on his leg and took a picture of Wim and the tattoo, and whatever he said, it felt very much like a new religion, which I think you're a researcher, you treat these things, and all of us should, with appropriate skepticism. Most of all, the person leading, hopefully with great, as they say, with great power comes great responsibility. So hopefully that's a message, and you and some other researchers I know who talk about this openly can get that across. Hopefully we can at least check some of those negative impulses or normal impulses that lead to negative consequences. I think it's a very balanced approach, and I'm glad you mentioned that. I think it's the first person on the podcast who's talked openly about some of those kind of more humanistic impulses we have.
Yeah. And it's very interesting what you say about, Wim. I've never met him, and I can't claim to be an expert, but I've spent some time, reading and trying the methods. And, he seems like a guy that tries his best to not, again, I don't know what I'm not aware of, but he tries to portray himself as just a regular dude that, he tells people, he's like, yeah, I drink a Heineken with dinner every night. It's like, it doesn't sound like he's going for the guru, angle. But despite that, people just, yeah, as you're describing, have that tendency, because like psychedelics, the things that these experiences, this framework that he has developed and refined from other traditions is one that can potentially gain access to, call it what you will, the transcendent, the spiritual, mystical, and humans are weird in their orientation towards that. And it's just the blind eye, like, the religious leaders and others, like whenever anyone is seen as the conduit to you name it, God, divine, mysteries of the universe, like, there is such a temptation to take advantage of that by that person and for the people surrounding to conflate that individual with the other, with that whatever, that transcendent reality that they may believe in. And frankly, I think psychedelics are the most extreme, probably, because
Yeah.
as great as breathing techniques are, and I mean, when you really compare the stories, I mean, as a technology to induce profoundly altered experiences, I mean, I don't think there's anything beyond the psychedelics.
Yeah, I agree. And I mean, it's in their name, their alternative name, entheogen,
Mm-hmm.
right? As you know, well, know better than I do. You know, it helps you tap into the God within. And if some people tap into the God within, they may ultimately believe they're God. I think, who was it? Maybe Huxley or someone said in Jim Fadiman's book, we had Jim Fadiman on the podcast a year ago,
Mm-hmm.
and his book, The Psychedelic Explorer's Guide,
Right.
he quoted one of these original researchers who said, if you take a little bit of psychedelics, you may believe you can talk to God. If you take a little bit more, you believe God is talking to you. And if you take a lot more, you don't know the difference between you and God. And so
Right.
that lends itself to this issue. I mean, we have a lot of Israeli medical students who learn by osmosis. And I went to Jerusalem for the first time, and there were warning signs everywhere that, hey, if you're feeling faint or you suddenly feel like you're Moses, it's called Jerusalem syndrome. So be on the lookout for this, because you may get such a impact from the vibe, the energy, your expectations of what Jerusalem is, that you could eventually leave. And supposedly 50 to 100 people every year succumb to Jerusalem syndrome. And it takes a couple of months for them to get out of it. But some of them, believe that they're prophets. So
Wow.
anyways, there's a lot of interesting stuff there. I'm sure we could talk for a couple hours over that, over some beer or whatever. I want to be respectful of your time, so I only had two other questions for you.
Mm-hmm.
The first is, what are you working on now? Like, what do you want our audience to know about you, about your research agenda that you're excited about, and how can they find you and follow up with your work?
Yeah, I'm taking my research in different directions. Certainly continuing with the smoking cessation work, but I've got some approved protocols. There have been some road bumps, but I've got protocols for using LSD to treat, FDA approved and IRB approved for LSD to treat chronic pain, people that are misusing opioids to treat chronic pain. So I'm like really excited about that one, just kind of doing work with LSD, which is a fascinating compound that hasn't been gotten the attention that I think it deserves in this modern research era, as well as addressing anything related to opioid, use, and certainly chronic pain, obviously such huge, important topics. And if we could find some efficacy there, it could help a lot of people potentially. Another protocol to treat PTSD, and another protocol to treat straight up opioid addiction with psilocybin, and PTSD with psilocybin. So I'm excited of all that. I am excited about some of these stories on the more neurological side. People, athletes claiming repair cognitive problems with sports associated with repeated, head impact. There's these very interesting anecdotes, but not just the mood and addiction stuff, but people saying they feel like their memory and other aspects of cognition have improved because of psychedelics. That could be consistent with some of the neuroplastic findings in animals such as rats. We don't know if those neuroplastic findings are at play with humans. They probably are. We don't know exactly what role they play and the therapeutics effects we've seen with the number of mental health disorders we've looked at as a field. But they would certainly be relevant, if they're unfolding in humans, to these anecdotes, if there's something real there of repair. So it opens up the potential world of, oh, is there the possibility of helping with stroke recovery, kids that are born who have gone through hypoxia ischemia, infants, like, are these potential technologies that could really help repair the brain at a straight up a neurological level, not just the treatment of mental health disorders. So I think that work is fascinating. I hope to get into that as time continues. And I'm also just very interested in shining light on some of the topics that in whatever way I can, some of the topics that I've discussed with you, that big picture stuff about where this is going. It's just going to get so weird. And as someone who's obviously believes in the power of this stuff and not operating in a place where I'm just responding to the some of the propaganda over the years, or just an uninformed. I mean, I've seen hundreds of people go through this for a couple of decades now, and I've been in sessions, I've designed studies, I've like talked to, oh gosh, I don't even know, hundreds at least, maybe thousands of people about their stories. Like I do feel that I need to spend more time with a focus on helping to navigate how we're going to address those big picture, issues. How do you harness the what many people, believe is a conduit to the sacred, however they define that, and to how does that fit into secular medicine? How does that fit into a society where we seem to be primed to, well, into a species, I should say, where we seem to be primed to look for the new religion, look for the new cult leaders, and hopefully, maybe, along with others with the same concerns, providing some advice that may be helpful to some people out there to nudge things in a healthier direction, to get as much benefit as we can, and to minimize, we're not going to eliminate it, but to minimize some of these these adverse effects, and to use a metaphor here, in terms of the society, what are the adverse effects for society, and how can we minimize those and maximize the positive effects for society.
Yeah, it's very nuanced and very exciting. Kind of mirrors what's happening with the AI renaissance or revolution right now too. Of like, it's a very powerful man-made technology. Well, obviously psilocybin is not man-made, but the studies and the delivery systems and everything around that are human-made, and maybe too powerful sometimes. And both psychedelics, AI, and now we have this Christopher Nolan movie on Oppenheimer coming out as maybe a reminder of how Oppenheimer kind of regretted what he did there. It's very interesting, and the next couple of years will be fascinating to see or partake in.
Indeed.
My last question for you is there any advice you want to leave our audience with about approaching their careers or changing their careers in some cases? Just advice you'd give to any mentee of yours.
One of the kind of generic pieces of advice that I think fits into all kinds of niches, no matter what someone's interested in, is if you're looking to do research, or gosh, this not just research, we're at the point where, just being a straight up clinician, a physician, psychologist, social worker, nurse, etc., wanting to specialize in psychedelics, like, first become an expert in that thing you want to interface with psychedelics. So like I tell people, if you have the opportunity to work with someone who's really well established and grounded in their field, let's say you want to use psychedelics to treat PTSD, and you have the opportunity to say you're going to grad school as a clinical psychologist or experimental psychologist, and you had the opportunity to work with a new, very like gung-ho, new assistant professor who's doing something with psychedelics, but it's not very established in the field. And, maybe you'll learn something about PTSD, or maybe that's not even their main focus. Maybe they don't know anything about PTSD, versus, working with a really established, person, maybe a full professor, that, not that they have to be, but someone who just, would put you on a really good track record to being an expert in PTSD. Do that, even if it means putting your interest in psychedelics on hold, your professional interest in psychedelics on hold. And it's really not, that's overstating it. It's not putting your interest on hold. It just, in terms of actually being directly involved with psychedelic work, you can still be interested, you can still read the literature, sow those seeds, but become an expert in PTSD. And then you can wait till your postdoc or your residency or whatever that next phase of your career is, to move into the psychedelics. And I think as time goes on, it's more likely sometimes you don't have to make those trade-offs. Like if you could find the best of both worlds and jump into the psychedelics more immediately, that's great. But that sort of trade-off might show up in more subtle ways, but to really just become the best physician of whatever specialty, to become the best psychologist of whatever variety, to become the best social, you name it, and really make that your focus, rather than letting psychedelics become the exclusive focus, and putting your interest and your potential to fully develop and be respected in the field, and to have advantages of developing that expertise in that in the area you want to combine with psychedelics. So I think that's important. And then I'd say just you try to take a balanced approach to this stuff. Listen to all the voices. I mean, gosh, there's not many left, but like if you meet physicians that were around in the early 70s, late 60s, who know what it's like when the average dose of LSD on the street was 300 micrograms, way higher than today. It's like there were some real bad trips, and there were some real, and there still are. It was just more frequently back in the like in those eras. Try to really find the truth, and there's usually at least a kernel of truth into even some of the concerns that might be blown into propaganda at their most extreme. But it is humbling. I mean, these are powerful tools, and try to just be familiar with that, and I guess consistent with that. Really, I would advise people to really know the history. I became, especially in the early years, very obsessed with the history of this work, reading the classic books. If you're going into psychedelics, you should know what the MK Ultra program was. You need to read Acid Dreams. You need to know about this very real history. You need to, read the classic Storming Heaven, and there's many others. And then the older literature, scientific literature, those older, papers. There's a lot of what I've seen is like people might think they're the first coming upon something. And I mean, you just read stuff in papers from the 1950s. It's like, my God, this could be like today. Like we have, and certain things we haven't figured out anything new. Back in the day when people could just like, oh yeah, we said we were doctors, and late 50s, Sandoz would say they'd be willing to give some LSD to anyone interested in research. So you just write them, I'm a doctor, and it's like, I want to try it on some patients. Cool. And it's like, yeah, there can be some issues, and there were some issues with that, but it also was an environment where people were trying wild stuff, including very interesting things, and they weren't as constrained. And so in a sense, they were at the cutting edge in terms of really just being able to try stuff clinically that we're still not at. And I think we'll probably be a little bit back into that once there's approval for MDMA and psilocybin, and there's off-label use. You're probably going to be back in that to some degree of Wild West, where there's that clinical experimentation, which is going to come with both good and bad. But here I'm talking about the good. Know that history, and remind yourself that like this isn't new. And then of course I should also say, it is different, and it's all to be taken in the appropriate context. But obviously be familiar with the the ancient history of indigenous use, and not that we can use that as a direct role model, but it's relevant. And just be as aware as you can about where we came from and where we are now. I love it when I'm writing a paper and I'm like, oh yeah, there's a paper from like 1962 or 1959 that makes this point. And just to remind people, like, cite that, to remind people like, yeah, some of this thinking has been around a long time, and delve into that history because it could really serve you.
Both those are very great advice, and I'll just respond really quickly before I let you go. But the first is one of the guys I met last week was an author. I had read his book before, Brian Murarescu.
Oh yeah, I know Brian, great guy.
You know Brian?
Mm-hmm.
Yeah, great. The Immortality Key, excellent book, talked about the Eleusinian mysteries. And it's interesting because kind of the undertone last week at the conference was that, we could screw it up again, right? Like just like the 60s and 70s, Timothy Leary, like this could go, if it goes bad and gets publicized, it could be put underground again. So a lot of people think about like that history because that's within people's lifetimes. We had Bill Richards on the podcast 2 weeks ago. It was within his lifetime. He went to Tim Leary's mansion. So the stories are very interesting, and Jim Fadiman too was there. He took with Ram Dass, he took his first psilocybin experience before going to see Aldous Huxley speak in Copenhagen. It's kind of cool that we're within arm's reach of that still. But the Eleusinian mysteries, of course, we weren't. And so it's like that was even before, and there's probably hundreds of examples of that emerging,
right.
Birthing, rebirthing, and dying. And so this could happen. This will happen again eventually. It's just a matter of time.
Yeah, the rug being pulled out. The late 60s wasn't the first time when that happened. If, like you're saying, my take is, I think consistent with Brian's take, we still don't know definitively, but my take would be, maybe I should only put this in my words, it seems more likely than not that there was an ergot derivative, a very LSD-like compound at the heart of the, that was the kykeon, that was at the heart of the Eleusinian mysteries. And so if that was the case, then yeah, the church came in and like, even though it had gone on, hundreds or I think even thousands of years, that the rug was pulled out then for centuries. So
yeah. It's dark ages, same thing for a lot of different things, not just psychedelics, but literature and, women's rights. I mean, all sorts of things have gone through phases.
Right.
And the second one, this is interesting. When I was in Israel last year, I met in Tel Aviv the founder of Waze, a really cool guy named Uri Levine. And he just came out with a book this past year called Fall in Love with the Problem, Not the Solution, which I think speaks to your first point, which is psychedelics could be a solution for things, right? They could also be a problem, but they, right now, a lot of people, they seem to be wanting to enter the field. I want to do psychedelics and whatever it is. So I want to use the solution for whatever problems are out there. But your take is similar to his, which is the problem is PTSD, right? That's a problem. So there could be 10 different interventions for it, psychedelics being one of them. So fall in love deeply with the problem, understand PTSD deeply, and then, let that guide you on what the solutions may be, as opposed to the other way around of like, I love this psychedelic solution. Let me, figure out, I have a hammer, everything's a nail. Let me figure out how to solve everything. But I think just the nuance that you've expressed here, I think is important.
If the idea is to, to have a powerful tool to probe the mind, if you want to put it that way, or to probe this interface between experience and the nervous system, it's like, yes, even with that, psychedelics are a tool, but it doesn't, it may, lead to other and interactive with other tools as ways to explore that interface and address those more basic questions. So even that, like, what you're saying is I think right on. It's like to focus on the problem, like what, and in many cases, psychedelics may be the thing that is the most fruitful way to make forward, but it may not always be, and it may not be the only thing, and it might be interactive, and there might be more about the ways. Something other things, like we're still in our infancy in terms of how we're using psychedelics. It's like there's virtually zero science on how to conduct different styles of therapy with psychedelics. It's like, so that's an example of what you're talking about. Like even with that, just like, hey, rather than all the studies being about psychedelic versus placebo, or this psychedelic versus that psychedelic, what about the same psychedelic therapy with cognitive behavioral therapy versus motivational enhancement therapy, or like what for addiction, for example, or there's basically no research at all like that, so focus on the problem, however you define that.
I think those are inspiring words to end on for our audience. So Matt, I really want to thank you for your time on this podcast. Thanks for going over, but also more importantly for the work that you've done directly to help lead to this renaissance that has so much potential for smoking cessation and many other conditions.
Oh, thanks, Shiv. Been a pleasure chatting with you, and thanks for your focus on the psychedelic topic. Appreciate it.
Totally. And with that, I'm Shiv Gaglani. Thank you to our audience for checking out today's show. And remember to do your part to raise the line and strengthen our healthcare system. We're all in this together. Take care.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelines podcast.